Welcome to Continuing Medical Education for Emergency Medical Services Providers. This is Left Ventricular Assist Devices, Part 1, Heart Failure.
All right, today we're going to talk about the left ventricular assist device, or LVADs, and its role in the treatment of heart failure. This program is divided into 4 modules, and the first thing we're going to talk about is the impact of heart failure on patients. So we're going to talk about heart failure and cardiogenic shock, discuss what is an LVAD and the first responders and emergency medical providers' role in treating these patients and emergencies they may encounter. At the end of today's talk, hopefully you'll agree that for every patient who's in respiratory failure, you probably today think that they are a candidate for mechanical ventilation and find that to be a pretty normal thing. In 2010, at the end of today's talk, hopefully you'll agree that every patient in circulatory failure also should then be considered a candidate for mechanical circulation. These patients are out and around in your community. If you're listening to this talk in New York State, you probably have one of these patients, if not in your own community, but in the county where you work, and they're out active members of society who return to work and lead relatively active lives. This is a patient in Rochester, New York, who, as you look at him, is exerting himself playing trumpet as a professional jazz musician. The heart itself, everyone at this point should be very comfortable with the heart. One of the things I do want to emphasize to everybody is that you all probably had to learn about right ventricular failure and left ventricular failure in terms of their signs and symptoms early on in your training. This holds true today when we talk about how we treat these patients and the role of just using a left-sided heart assist pump. That these patients can get into trouble in the future if they were to have pulmonary or lung complications and flow from right to left and the circulation system were to be inhibited. But for most of the patients, even if the right side does stop, blood will passively flow right to left and the pump will be still able to sustain circulation for the patient. When we think about flow and the normal anatomy of the heart, a lot of us traditionally think about blood pressure as a normal evidence of good circulation or perfusion. In this situation, for the purpose of talking about LVAD patients, you really need to think about pressure won't matter as much, and that truly blood flow in terms of the liters per minute or cardiac output that the organs see is the more important factor to consider. For these patients, you will be able to hook them up to their displays at home and see what truly is their actual cardiac output. For most of the patients that go on to receive a left ventricular assist device, these patients you've probably seen when they originally had their heart attacks or have been in your system for either exacerbations of heart failure or treatment for acute coronary syndromes. So for the bulk of these patients, it starts with an acute myocardial infarction. A significant amount of muscle is lost and they develop what we consider an ischemic cardiomyopathy. From this ischemic cardiomyopathy or pump failure, they traditionally develop what formerly was referred to as congestive heart failure, but we now know that not all heart failure is congestive, and they develop heart failure symptoms. Who dies suddenly from heart disease? This is actually very important to consider. A lot of the patients who go on to receive a left ventricular assist device are actually younger patients who have not had long-standing coronary disease. If you think about the development of atherosclerosis and chronic occlusion of coronary arteries, those patients can actually develop what we call collateral circulation that develops blood supply to the heart muscle from actually 2 different directions. A lot of patients who go on to receive heart transplant or need a left ventricular assist device are unfortunately a younger population who don't have collateral blood flow to the muscle, and actually when they have their heart attack, the muscle is less preserved and have larger injuries to the myocardium. In heart failure, as we know, the X-ray on the left of your screen is a normal heart, and patients develop an enlarged heart, as you see on the right side of the screen, doubling if not tripling their average heart size. This is actually very important to consider because these patients not only develop shortness of breath from the inadequate delivery of oxygen to their tissues, but they actually develop shortness of breath from the pure fact that they have a heart 2 and 3 times the size occupying their chest cavity, displacing lung tissue. Other cardiomyopathies that we often see patients for that may or may not be able to receive a left ventricular assist device include what we call a dilated cardiomyopathy from either valvular disease, postpartum cardiomyopathy, an alcoholic-induced cardiomyopathy, familial cardiomyopathy. Some of the ones that are less likely to be treated or cannot be treated with a left ventricular assist device include enlarged hearts that actually have small heart cavities or restrictive cardiomyopathies. So what is heart failure to you? Probably a lot of you see patients every day who have heart failure symptoms. These patients, as you think about this, are acutely short of breath or chronically short of breath are any other color but pink. They're ashen, they're gray, they're cyanotic, often tachycardic, dyspneic, exhibiting symptoms of poor perfusion. Many of you know the difference between a person who's been shot is in hypovolemic shock, and the person in cardiogenic shock is the person who has a traumatic injury, their tank is empty but the pump works, versus the person in cardiogenic shock, the tank is full but the pump is broken. How do we treat these patients? In most emergency settings, we treat these patients with oxygen, afterload reduction, increasing the strength of their contractility, and treatments to really alleviate their symptoms. In all forms of medicine, what are we trying to accomplish? We do things for two reasons. We try to either prolong life or actually improve quality of life. When we talk about treating patients with heart failure, unfortunately, the options for prolonging life and increasing quality of life are very, very difficult. So that begs to answer the question, is there really a cure? If patients were traumatically injured, we'd expect their skeletal bones to heal, them to recover from the traumatic injuries. If someone presents with cancer, every cancer patient wants to hear that somehow we're going to eradicate their cancer by cutting it out, poisoning it, or removing it from their body. Unfortunately, every patient you have who presents with heart failure doesn't actually have good treatment options that will result in a cure. The management strategies often used include diuretics, nitrates, ACE inhibitors, beta blockers, DIG, arrhythmia management, or inotropic therapy. If you were to see a patient who has class 4 heart failure or stage D symptoms that actually was unable to walk to their mailbox, walk a flight of stairs, or have symptoms with simple exertion, unfortunately that patient, if we were to treat them like a cancer patient, we would say that they have a 50% one-year survival, with nearly all of these patients being dead at 5 years. The gold standard for treatment of heart failure in its advanced stages of class 4 or stage D symptoms, as we all know, is cardiac transplant. The picture of the patient on the left, as you see, is a chest with no heart in it, and on the right you see the 2 operating room teams performing a transplant. In the back is the new heart being prepared, and in the center of the picture is the recipient being prepared to receive that new heart. Unfortunately, in the United States, 250,000 patients will die next year of heart failure, and there are only 2,000 heart transplants performed nationally in this country. With an aging population and decreased availability to donors, this really doesn't represent a long-term treatment option for patients with heart failure. What we're going to talk about today is the ventricular assist device, or often terms of VAD. The research shows VAD patients who were previously in advanced heart failure, only 8% of those patients are alive after 2 years of advanced or late-stage heart failure. When we compare that with patients treated with a left ventricular assist device, over 50% of those patients are not only alive, but living free from heart failure symptoms. When we consider all the pumps that are out there today, you'll find that there are over 30 pumps either in clinical human trials or in early basic science or animal development around the country. Many of these pumps are used in most hospitals that provide cardiac surgery or cardiac transplant.